About postpartum hemorrhage. First off, what is postpartum hemorrhage? This is when there is greater than 1,000 milliliters of blood loss with signs and symptoms of hypovolemia within 24 hours of birth. The uterus is often called the living ligature. Let me explain. This is a blood-saving mechanism. When the placenta separates from the uterine wall, these fibers contract, causing constriction of the blood vessels, which prevents the mother from bleeding out. If the uterus is not effectively doing this crimping off, it causes bleeding. Let's use my hands as an example. Let's say my fingers are the uterine fibers and the straw is a blood vessel. Now, when the uterus contracts, it causes the blood vessels to be crimped off, which stops the mother from bleeding. But let's say the uterus for some reason was not doing this contracting, it would cause the blood vessels to be open, causing massive bleeding. So it's so important that this compression is happening. We call this the living ligature or the blood-saving mechanism of the uterus. Let's look at some reasons why this happens. Polyhydramnios, a macrosomic fetus or a large fetus, and a multifetal gestation. These all cause an overdistended uterus. And again, if the uterus is distended, it can't contract well enough to stop the bleeding. The number one risk factor for postpartum hemorrhage is a full bladder. Now, this is because a full bladder can cause distension of the uterus and again, interfering with those life-saving contractions. Okay, now for signs and symptoms. Now we have hypotonia of the uterus and uterine atony. If we break apart this word, hypo means low and tonia means muscle tone. And A means without, and again, tony is referring to muscle tone. Now we can see how a low muscle tone can really be a sign of postpartum hemorrhage because we know those life-saving contractions are not happening, therefore they're not crimping off, stopping the blood vessels from bleeding. Now for some nursing considerations. The two treatment options you absolutely need to be familiar with is to firmly massage the fundus, and the top medication used is oxytocin or Pitocin. Let's look at why these two are so important. When you firmly massage the uterus, this helps the uterus to contract. And oxytocin, brand name Pitocin, also helps the uterus to contract.